Hey, I'm Foxberry, and welcome to my channel. This is where I talk about politics, hyperfixations, and whatever really crosses my mind while I practice my art, or if I'm lazy, just overlay some Monster Rancher for gameplay over it, because why not? This channel's all about me and whatever I want to do, so why don't we just get into it already? Alright, see you soon. Hey, you can call me Foxberry. I'm here to talk to you about non-binary transitions. As such information is difficult to come across, please stay tuned for a lot of information on different medications and surgeries specifically applicable to non-binary transitions. Beware, I will be discussing anatomy in this video. If that's not comfortable for you, please skip this one out. Full disclosure for this video, when I speak about non-binary transitions, I'm referring to transitions that aren't typical MTF or FTM transitions. On the internet, most videos or articles on non-binary transitions are just binary transitions and treatments with the word non-binary slapped onto it. I'm not going to waste your time like that. I'm not going to waste your attention by laying out things like traditional estrogen or testosterone treatments or MTF or FTM sex reassignment surgeries. I'm going to be exclusively covering treatments that are not typically binary here. So without any further ado, here are the treatments currently available on planet Earth for other non-binary people who both exist and transition regardless of recognition by the United States government. First off, let's talk about something important. Non-binary as a term refers to multiple different genders and therefore multiple different bodies. In terms of medical transition, we have two methods of treating dysphoria: removing things and adding things. When we talk about adding things, we tend to think of hormone replacement therapy, which does make significant amount of changes to the body. I have a customized HRT plan because I'm non-binary, and in my personal experience, this was very effective at making my body match my gender. It's also made me much more androgynous than I was pre-transition. The HRT plan that I chose is estradiol monotherapy, which means that I take oral estradiol without a testosterone blocker. From what I've heard, monotherapy with estrogen injections will naturally block testosterone, so I would advise using oral estrogen for this, not injections. I do not have the experience of using the injections, so take that with a grain of salt. The reason I chose this plan are as follows. I did not experience as much muscle atrophy as a typical trans woman would have experienced on a streamlined treatment path. My body hair growth patterns were not as effective, and though I grow female hair, I have not seen redistribution of the growth patterns. This way, I have more control over what I can get rid of with laser hair removal therapy. I have received breast growth, which I am pleased with. I don't know if it's because I opted out of a testosterone blocker, but my results are perfect for me. I didn't receive anything larger than a B cup so far. For reference, I have been on treatments for over 12 months at the time of uploading this video. My hips did change significantly and now are in a more feminine position than before. I did not experience erectile dysfunction, which I was told by my provider is because I chose monotherapy, and was the primary reason that I chose this option. But keep in mind that your mileage may vary, and you might not have as successful results as I did. Estrogen monotherapy might take you farther than your goal is, or it might not take you as far as you would like, so be careful and take this with a grain of salt. This pathway also restricts my alcohol consumption, as oral estradiol is processed in the liver, and drinking while taking it can put unnecessary stress on that organ. If you are transitioning from female, don't worry, I will get to you in a second. For other people who are AMAB and wish to transition, but do not feel comfortable having breasts, you might have the choice to take an SERM, which stands for Selective Estrogen Receptor Modulator, which changes the way your body processes estrogen and can provide some androgenizing effects. The most effective of these so far seems to be ralox. SERMs can be dangerous and may lead to the development of osteoporosis, despite the medication existing as a treatment for osteoporosis. Talk to your doctor and monitor your bone health if possible. It can cause a typically female fat distribution, and it can cause changes in skin texture. However, it may cause an increase in dihydrotestosterone, which can lead to male pattern baldness. There isn't enough research to fully understand the potential risks of these treatments, so be careful. I don't personally know anyone who's on these treatments, and there are very few cases in which individuals receive them. According to anecdotal reports, which should be taken with a grain of salt, it provides estrogenic effects in the bones, fat distribution, odor, and skin, possibly some hair thinning, but not to the same degree as estrogen does, making you appear more androgynous. When taken with estrogen, the effects of the hormone may overpower your SERM. However, some sources say that to meet any sort of noticeable transition goal with them, they must be taken with estrogen. What I do know is that this medication is known in the non-binary community for providing estrogenizing effects while reducing your risk of breast development. Keep in mind that we do not know much about this medication in AMAB bodies and cannot completely rule out breast growth in your specific SERM regimen. I have also heard certain gonadotropin releasing hormone agonists, GRHAs, have been used for some assigned male at birth patients as a form of demasculinization. However, reports on this are limited. The costs are also extremely high. This treatment can also be used for assigned female at birth people who are looking to defeminize themselves and possibly end their menstrual cycle. But again, it is not common. So uncommon that I was not able to find reliable accounts of its effects. Now for hormone treatments for my assigned female at birth audience. I know you guys are often overlooked or assumed to be riding some kind of trend. I'm here to tell you that if you're seeking this information, you're probably not. Don't let anyone else's opinion of you dictate whether or not your dysphoria is worth treating. I would like to warn anyone watching that I'm not assigned female at birth and do not have much experience hearing about these treatments. Please talk to your doctor when you can. Finasteride in pair with testosterone is sometimes used to prevent some of the changes in testosterone, such as male pattern baldness. This works because finasteride prevents the conversion of testosterone into dihydrotestosterone. Finasteride might block certain changes in muscle development and might have an effect on fat distribution, though your mileage may vary. Dihydrotestosterone might be taken to introduce certain effects of testosterone without causing voice deepening, but it might also cause male pattern baldness. I'm not sure what you can take it with, but you will not be able to take it with finasteride to prevent male pattern baldness, because finasteride works by blocking dihydrotestosterone. So discuss with your doctor what medications may be available to prevent this change. This isn't always going to prevent deepening, so be careful, as mileage may vary. Some people take low-dose testosterone for slower masculinizing effects, which is more common. However, it's important to note that even small doses of testosterone can cause permanent effects you may not want, like voice deepening, facial hair, or body hair growth. Danazol is a low-strength masculinizing drug used to primarily stop periods, but it may pose pleasing results to people who are looking for subtle defeminization. You would be taking it at a higher dose than someone taking it for birth control might be taking it at. Your mileage may vary. This treatment was meant to treat endometriosis, but depending on the dose, could cause certain issues if not taken properly, or may not do anything at all. The obvious problem with this is it is a form of birth control, so you may struggle to have kids while taking this treatment. Some assigned female at birth people might observe some of the permanent effects of testosterone, and then cease taking it to maintain the observed effects, but prevent any further masculinization. However, it's not ideal for your body to go through phases of different dominant sex hormones over different periods. Please monitor your health while beginning and ceasing testosterone. You cannot predict what will and will not change on testosterone, no matter how low the dose, or how short of a period it is taken. Be cautious and discuss how you feel with your doctors before stopping or starting testosterone again. Now that we have covered hormone therapies, it's time to discuss non-surgical procedures that may help alleviate dysphoria in non-binary people seeking to get treatment. For those who are of any assigned sex, you can prevent breast growth with breast bud radiation therapy. Be you someone who is using estrogen or just someone trying to prevent breast development during your first puberty. This option may be accessible to you, and you might be able to get referred to a professional who performs this treatment by a gender-affirming care specialist in order to prevent breast growth. Hair removal is also an option across the board that doesn't need explaining because it's standard for binary trans people too. But I wanted to point out that you can customize a laser hair removal plan to opt in or out of certain areas, or customize your experience down to the inch. For example, you could have your beard and mustache removed, but not your sideburns, if that's truly what you want. It's time to talk about surgery. This is gonna get a bit uncomfortable. Warning, we will be discussing basic human anatomy ahead. If you can't handle that, please skip this section. Top surgery for AFAB individuals can be customized to remove the breasts without actually masculinizing the chest, creating a more flat appearance. Breast reductions can also be utilized to make breasts more manageable without completely removing them. You can customize facial feminization or facial masculinization surgery. This can be done to achieve a more androgynous look while still getting surgery to remove unwanted features and boosting wanted ones. Bottom surgery is the last thing that I wanted to talk about, but also one of the least discussed things in terms of non-binary transitions. Surgical options for non-binary individuals tend to fall into two categories: salmation surgery and nullification surgery. However, there also exist people who report having surgery to make their primary sex characteristics ambiguous, but not in the way a salmation or nullification surgery would. Salmation surgeries are when you have sex reassignment surgery to change your genitals to have aspects of both sexes. In terms of salmation surgeries, there are a few options for you depending on which sex you're transitioning from and what your goals are. For people who are transitioning from male to X, have a lot of options, mostly derived from the peritoneal pull-through method, commonly used in some MTF patients. These surgeries create a vagina without using the tissue directly from the phallus. This way, you have the option of sparing certain parts and still having a vagina and or labias. It may involve a skin graft from other parts of the body in order to construct certain structures. This can be personalized through discussions with your surgeon. Such options to discuss with your surgeon includes phallus-preserving vaginoplasty or scrotum and phallus-preserving vaginoplasty. There are also reports of people who have had their testes moved inside of the body but removed the scrotum and had salmation surgery on top. There's also one report I have found of someone moving the testicles to have them visibly weighing on the labias from the inside to create a look distinctly from the female labias, which they called scrabias. These are the only cases I've been able to find online, as talk on this is very hush-hush. I have never met a person in real life who has had any of these surgeries, as they are very rarely performed. Pursue at your own risk. For people who are transitioning from female to X seeking salmation surgery, can have metoidioplasties that spare the vagina, and may have the option to also have a scrotoplasty on top of that. The process is in general a lot more streamlined for FTX patients, considering the metoidioplasty is a very common surgery for trans men who want their penis to be functional or somewhat functional. Ask your surgeon about vagina-sparing metoidioplasty and vagina-sparing scrotoplasty. I have less information on these surgeries as I'm not assigned female at birth, so please do your own research. Nullification surgeries are different depending on your assigned sex at birth, but typically have a similar outcome. For both MTX and FTX individuals, this surgery involves removing the penis or closing the vagina as much as possible to provide a smooth, unbroken appearance aside from the urethra. For MTX patients, this also involves changing the position of the urethra, enabling them to be able to sit down to urinate. MTX patients also have the option to reposition the glands in order to preserve the nerves and maintain the ability to enjoy intercourse with the area. For FTX patients, this involves closing everything up as smooth and unbroken as possible, leaving the urethra in order to preserve urinary function. For FTX patients, the clitoris can also be preserved and remain underneath in a similar position to where the glands would be moved for an MTX patient in order to enjoy sexual stimulation as well. I'm not very personally educated on nullification surgeries, as this has never been my goal. If you would like more in-depth discussion on these options, please do your own research. Now, why would I make a whole video just to say to do your own research for most of it? Well, I'm not a medical authority. I'm only responsible for understanding in completion my own transition pathway. Furthermore, so much of this stuff is so very difficult to get a hold of in the first place. Most doctors won't prescribe you something like SERMs, for example, and most of the people taking it are doing it through the means of do-it-yourself hormones, or DIY, where they are not obtaining them through the typical pathway, which would require a prescription from a doctor, which I don't normally personally condone, but you kind of have to do what you have to do, especially when times are tough right now. This makes information on results very difficult to find. It has been a lot of work compiling the information I do have. This video wasn't to teach you the ins and outs of non-binary transition. It's to broadcast to whoever needs to know it. Non-binary transitions do exist, they are designed for our use, and they do need development. The more of us seeking these treatments, the more normalized they become, the more streamlined they become, and the easier they become to access. We need to spread the word with safe people about our treatments. If you have any questions, please feel free to ask in the comments. I will answer them the best I can, and maybe even might make a video on the specific treatments brought up. If no one else, I will educate someone. That's all the information I have. I really wish I had more, but this information wasn't very easy to come by. If anyone has more information they would like to add, please let me know, and I will consider adding it to a second video like this one, where I explain the treatments I may have missed. If you think any information in this video is inaccurate, please tell me, and I will correct myself in a future upload. Thank you for watching. If you'd like to see more of my content, please check out my link tree in the pinned comment. I'd really like to boost my audience, and if you could engage with my content anywhere, that would really help. If you'd like to see more people who share similar beliefs to me or have similar experiences, please join my Discord, which is also linked in the link tree. Thank you for watching and have a good evening. Goodbye. Hi, Jerry. My cat's here. Hi. Aww.